Welcome back to UroFill Shorts. We're going to do something today that I really didn't want to do, but this is occurring right here in our own backyard, and I'm sure it's occurring all over the country. You really need to be aware of the abilities of your provider and what sort of algorithm they're using when they're trying to perform girth enhancement upon you. Well, I'm going to show you a couple of examples that came in the door this last week. One coming from a plastic surgeon who was basically utilizing a technique that was described in 2000. In that technique, what they try to do is get as many units put in at one time as they possibly can. And if you're a urologist, you understand that this is what lights up your lymphatic system and eats up all that hyaluronic acid that you spent so much money on. And this poor fella came in with 12 and a half injected all at once, and almost all of it was gone, and it had what was there that was not placed in the correct position, so it did not appear at all physiologic. This second series of cases, I'm going to show you a couple of them, come from somebody else who's not even a plastic surgeon. I would prefer to call it a beautician, and they're injecting some components that they don't necessarily describe on their website, and you end up with some catastrophic results. I'm going to show you the ones that are palatable. There are worse cases that we could show you, but it's just not suited for this. And what you'll see here in this very first picture is where some of these materials were injected into the glands, and he almost lost his glands, the head of the penis. In this other one, you'll see how this material, which is supposedly a proprietary combination of silicone and collagen, where it just tends to migrate, which doesn't happen when you inject it into the proper place, and you end up with these horrific end results that are not at all physiologic, not symmetric, and terrifying for the patient. And unfortunately, because of the material, in order to get these out, it is major surgery. So we didn't want to do this, but I just saw two cases in my own backyard when people should know that the UroFill technique is the only safe and effective technique for girth enhancement of the penis. Thanks.